Dickinson. I'm the Director of Rehab Services and Alive Clinical Services. So I'll do a quick introduction. I'm just going to let you know their names and where they're located, and then I'll let them both tell them a little bit about themselves. Dr. Baxter is presenting today. He has a physician practice in Potterville, associated with Sparrow Hospital, and so now us, which is great. And then his RN, Julie. Julie is with him, so I'll just let them go ahead and tell about themselves, and thank you again for coming. All right, so let's welcome them both.
So yes, my name's Dr. Ryan Baxter. I work at Sparrow Medical Group Potterville. Together it's me and Dr. Miller, who are the two doctors there. I see a few familiar faces from people we've seen at Potterville. But I just briefly about myself. I grew up in Wisconsin, attended the University of Wisconsin-Madison for medical school, did my residency in California, and then came back and started here at Sparrow in Michigan. And then I can have Julie tell a little bit about herself too.
Hi everyone, my name is Julie. I'm a nurse. I've been a nurse for about 15 years, and my current role is fairly new. I've been working as a chronic care manager for almost a year. This month will be a year. And I work with Sparrow Medical Group with Dr. Baxter and Dr. Miller. And I also work in the Lansing location at the professional building in a primary care office there also. I talk with folks about caring about their chronic care disease processes, whatever that may be, such as diabetes, which is a big one. I pretty much was born and raised in the Tri-County area in Michigan, so I did receive an associate degree in nursing at LCC in 2000, and I went back and finished my bachelor's degree, completed that in 2012 through University of Michigan. So I'm happy to be here with you today.
Thank you. And just before we get started, we were curious as to who we are talking to. So we wanted to know, and we can do by raise of hands, just how many of you have been told or diagnosed with diabetes? If you're okay raising your hands. And then, okay, so quite a few. How many have family members who are diabetic? Okay. And is anybody here just for pure curiosity? Okay.
You always have to learn something.
Okay, so we're trying to cover kind of a lot, talking about just living with diabetes and also how to prevent diabetes. So hopefully there'll be something for everyone. So, first question, obviously, what is diabetes? You hear this word a lot, but what does it really mean? So diabetes is a disease that occurs when your blood glucose, also called your blood sugar, is too high. Over time, having too much glucose in your blood can cause health problems such as heart disease, nerve damage, eye problems, and kidney disease. So symptoms that patients will feel when they have diabetes and maybe are not diagnosed as of yet. So people can be fatigued, they're always tired. People can say that they're feeling very thirsty, they're going to the bathroom a lot. If things start to get out of control, people can have trouble. They'll also feel hungry and they're kind of going along with the fatigue, but they'll actually, if your diabetes is really bad and not being treated, you can actually lose weight, but in a very unhealthy way. And when your sugar is high in your blood, you can get blurry vision, you can have infections that are not healing, wounds that will not heal, and numbness and tingling of the feet are some of the things that people will tell us before they even know that they have diabetes. So a little bit of a few numbers to throw at you. So as of 2014, 29.1 million people in the US, or about 9.3% of the population, have diabetes. And of those, about 1 in 4 people with diabetes don't know that they have the disease. They're walking around, they might be having some of these symptoms, but they've not been diagnosed, they haven't seen a doctor, so they do not know and are not treating their diabetes. And it's also estimated about 86 million Americans aged 20 years or older have prediabetes, which we'll talk about it. And then this says here, this graphic, it's basically that 1 in 3 Americans will develop diabetes in their lifetime. So that's a lot of people that are being affected. So there's a couple different types of diabetes, so we're briefly gonna just touch on that. So one, you'll hear about type 1 diabetes, which used to be called juvenile diabetes. It develops most often in young people. It can develop in children, even toddlers. But sometimes can develop as people are a little older, but in general develops when people are children. In type 1 diabetes, your body no longer makes insulin or enough insulin because the body's immune system has attacked and destroyed the cells that make insulin. Insulin is the hormone that your body uses to control the level of blood sugar in your blood. So it brings that sugar down, okay? It transfers it from the blood into your other body's cells. So type 1 diabetics, their body's not making insulin. So usually, with very few exceptions, all type 1 diabetic patients will be injecting themselves with insulin. Okay, so type 2 diabetes. So type 2 diabetes starts differently. We said it begins with something called insulin resistance, which is a condition that occurs when fat, muscle, and liver cells do not effectively use the insulin that your body is making to carry glucose into the body's cells and use for energy. As a result, the body needs more insulin to help glucose enter the cells and keep the glucose in your blood at a normal level. When this first starts, the pancreas keeps up with the added demand by making more insulin. However, over time, the pancreas can't keep up with insulin demands and blood sugar levels increase. So usually people develop insulin resistance when they are overweight, inactive, not following a good diet. That leads to this insulin resistance, and we'll talk about that. So prediabetes, another term that you'll hear. So prediabetes is when the amount of glucose in your blood is above normal, yet not quite high enough that we say that you are officially diabetic. And at this point is where we really want to catch people, because in these patients with some weight loss, some moderate physical activity, you can delay or completely prevent developing type 2 diabetes without taking any medications. So as the graphic kind of shows, it kind of starts with not following your diet, having not enough exercise, stress can play a factor, and then you can start developing prediabetes with the insulin resistance and eventually onto diabetes. So this is another graphic that's just showing that there's many components. So there are genetic components to developing diabetes. So it tends to run in families, and then there are lifestyle components. So genetic causes that lead you to be more prone to developing diabetes. If you're not managing your diet, eating foods with too much fat, too much sugar, not getting enough exercise, you begin to develop the insulin resistance. And then what happens is over time, your pancreas cannot keep up. The pancreas is what makes insulin in your body, and then you can develop diabetes, and that's type 2 diabetes. Type 1 diabetes is very different, and we won't talk about that today. Is there anything you wanted to add?
No, all of those are contributing factors, and a lot of that is what contributes to the reason that the rates are so high for diabetes, because a lot of our lifestyle nowadays in our country is low sedentary, low activity. We eat a lot of on-the-go foods that are high in fats and sugars, and also the genetic factor plays a role. So all of those things have contributed to why a lot of us are developing diabetes today.
Another thing that you'll hear about is something called gestational diabetes. So this is diabetes that affects particularly pregnant women. So all pregnant women make hormones that can lead to a level of insulin resistance. And all women late in their pregnancy will have insulin resistance. If the pancreas doesn't make enough insulin during pregnancy, a woman can develop gestational diabetes. Overweight women have a higher chance of developing gestational diabetes. Also, women who gain too much weight during pregnancy may increase the likelihood of developing gestational diabetes. Usually after the baby is born, gestational diabetes does resolve. However, a woman who has developed gestational diabetes while pregnant is more likely later on in life to develop type 2 diabetes. So, we're going to talk a little bit about managing diabetes. So there's a few steps that we're going to break it down into. Okay? So the first step is to learn more about your diabetes. Obviously take classes to learn more about living with diabetes like you guys are doing today. So congratulations, you've made it to the first step. You can, so there are probably many more offerings that Alive will have. Your physician or doctor may be able to refer you on to other classes, and there's a lot of online resources which we're going to talk about. You can join a support group. I believe that Alive has some support groups for diabetes and other chronic conditions. Again, you can also find them online. And you can go online to read about your diabetes. We'll give you some more good websites later on. And the last thing is I do want to say you should take diabetes seriously. Sometimes people tend to blow it off saying, oh, I have diabetes, but I'm fine. I take a pill, or my doctor says I'm fine, or I feel good. But sometimes, it can be surprising how it's having an effect on your body. And so we'll talk more about the long-term effects. So, managing your diabetes. Why do you want to do this? Why do we care about this number of the blood sugar that's floating around in your body? So, first and foremost, you will feel better, have more energy, be less tired, less thirsty. You won't be going to the bathroom and urinating as much. You'll heal better from both illnesses and any wounds, surgeries, things like that. You'll have fewer skin infections, fewer bladder infections. Also, good management will prevent other health problems such as heart attack and stroke, eye problems that can lead to trouble seeing or even going blind. It will prevent pain, tingling, or numbness in your hands or feet, also called nerve damage, and will prevent kidney problems that can stop your kidneys from working, and also dental problems. So, this is just a graphic to show how uncontrolled diabetes, what we can damage. I think this is a pump here. Yes. So it can affect your brain by leading to increased risk of stroke. And even when your sugar is very high, people will be confused. People won't be able to think very well. Diabetes will affect your eyes over time, and can even lead to blindness, trouble seeing, and worsen kind of development of cataracts and glaucoma. Obviously, it can lead to trouble with your teeth, so both more dental issues, cavities, gum disease, and a lot of more problems there. Heart, it affects your heart. It can lead to increased coronary artery disease, which leads to heart attacks and problems of that nature. It affects your kidneys, which leads to what we call diabetic nephropathy, so that can over time lead people to, have their kidneys fail and need things like dialysis or kidney transplant. And also the nerves of your body, it can lead to problems of polyneuropathy, so that's where your hands and feet go numb. You can have burning tingling, which is very painful, and then more problems from that can develop. So, the next step, there's the ABCs of diabetes. So you want to talk to your doctor about how to manage your A1C, your B, blood pressure, and C, your cholesterol. Because doing this helps lower your chance of having a heart attack, stroke, or other complications of diabetes. So I have the next slide, we'll talk more about the A1C. So the A1C test, what is it? The A1C is a blood test that measures your average blood sugar level over the past 3 months. It is different from the blood sugar checks you do each day. Why is it important? You don't want the A1C to get too high. High levels of blood sugar can harm your heart, blood vessels, kidney, feet, and eyes. And what is the A1C goal? In general, the goal for most patients with diabetes is to have your A1C at or below 7. So, the blood level, so this is a chart showing the A1C.
Okay, so, do you all know what your A1C is if you've been diagnosed? Okay, so that's very important, and the reason here is kind of where you can see your averages, and we can get a little bit more specific if you knew your exact number, but when you're at about a 6.5 or more, that number, it means your fasting glucose levels, so your sugar levels when you're not eating for a good period of time, anywhere from 8 to 12 hours, is averaging around 126. And then there's the oral glucose tolerance test. I don't generally look at that one a lot, but a normal blood sugar level is going to be below 100. Your A1C would read at about 5 at that point. And the reason the A1C is a very good indicator is because, as Dr. Baxter mentioned, it's kind of this 3-month average of what your sugars have been running. It's kind of like this rolling picture, because your red blood cells, or your hemoglobin, and that's the name of the test is called a hemoglobin A1C. Those red blood cells are coated with sugar. And the less controlled that is in your bloodstream, the more your sugar gets coated, or your blood cells get coated. And so when they're coated too much, this lab test will be able to see that, because your red blood cells, they last in your body for about 3 months. And then your bone marrow produces more. So if you're controlling your diabetes within a couple months, you'll be able to see an improvement in that number. So that's why that number is a very good indicator, rather than just checking what it is today, what it is when you woke up this morning. Yes, those numbers are important because we can see trends and kind of see how activity and diet affects those numbers. But this A1C is important for really good number to see generally how you've been managing those blood sugars throughout 2 to 3 months.
I wanted to go back, just this graphic here, this kind of thermometer here. So like we said, a non-diabetic patient, the A1C would be between 4 to 6, which shows a blood sugar that's most of the time below 100, but can go about as high as 125. A diabetic who's in very good control would have the A1C set between 6 and 7, which is about average blood sugar 127 to 155. And then as we go up, on the A1C up to 7 to 8, then you're just between 150 to 200. 8 to 10 is about 200 to 250, and 10.5 and above, you're about 250 and above on average. That's your average blood sugar.
If you are on medication, would your numbers ever get to 8.5?
If your medication is not strong enough, if you're not taking the medication correctly, not injecting enough insulin, yes, that can happen. And everybody's a little different with how much medication they will need. But yes, it can happen even if patients are on some medication. Blood pressure. So what is it? The blood pressure is the force of your blood against the wall of your blood vessels. And why is it important? And especially in the case of diabetics, if your blood pressure gets too high, it makes your heart work too hard. It can cause, it's one of the risk factors that causes heart attacks, stroke, and damage to your kidneys and eyes. So diabetes is already affecting your brain, your heart, your eyes and kidneys, and if your blood pressure is out of control, it's kind of a double hit against those vital organs. So what is your goal blood pressure? The blood pressure goal for most people with diabetes is below 140/90. Depending on how affected you are by diabetes, the goal may be a little lower than that. Cholesterol. So we hear about this all the time, but I just did want to clarify, there are actually two kinds of cholesterol in your blood. The first one is the LDL, which is the bad cholesterol, and it can build up and clog your blood vessels that can eventually lead to cause a heart attack or stroke. And the second is the HDL, or good cholesterol. And that cholesterol goes around and picks up the bad cholesterol from your blood vessels. So you actually want your HDL level to be high relative to your LDL. And again, for patients with diabetes, the goal is to have the LDL less than 100 and the HDL to be greater than 40. And again, if your cholesterol is out of control and you have diabetes, it's just another hit against your body, particularly your heart, that can lead to worsening of your overall health. All right, and then kind of step 3 in our 4-step program, so learning how to live with diabetes. So this is talking about eating well, being active, and knowing what to do each day to stay healthy. So it's kind of a broad topic. So healthy eating.
Okay, all right. A healthy diet helps us to lose weight, that also helps us to lower our A1C levels, our blood pressure, and our cholesterol. So really changing eating habits and making your diet healthier can affect an improvement in all of those areas. We encourage you to focus on a variety of foods, focus on the amount, so the portion sizes, and nutrition, so the types of food again. Choosing foods that have less saturated fats, less salt, and added sugars. And starting with small changes to build healthier eating lifestyles is the kind of the focus on making those small baby steps. And then once you've accomplished a goal, you can work on another one. Is there any more? Okay. So starting with a few small changes. And there are some resources on the back table and in our slides here too. Recommended eating habit for the government is myplate.gov. It's a recommended eating method for all of us, whether we have diabetes or not. And the focus of that, those recommendations are every time you're eating, visualizing your plate and having half of what you're eating be fruits or vegetables. Whole fruits are best, so if you can get fresh produce, that's great. Varying your vegetables. Veggies and fruits have a lot of antioxidants, and especially the colorful ones. Your purples, your oranges, greens, those aren't going to be the healthiest. As far as your grains, the goal is to make half of the grains you eat whole grains, whole grain and wheat, breads, rice, pasta, which are the foods that you do want to limit the amounts of, the portions of. And then moving from low-fat to fat-free dairies. So that can be as simple as going from a whole milk to a 1% or a skim, which generally people will do that in steps if you're used to drinking 2% or whole milk. If you just reduce that to the next step down, that can be most helpful. Varying your protein. So proteins are going to come from your meats. So we suggest lean meats, fish, chicken. And you can also get proteins from other healthy sources too. Your nuts are good sources. Low-fat dairy can be a source of protein. And then eating and drinking the right amount for you. So again, this is mentioned a couple times when they talk about amount. That's your portion size. And drinking, a couple things, you want to make sure you're drinking water, enough water every day. Staying hydrated will will help with your energy, it'll help with feeling full and not overeating, and reducing those sugary drinks, because they are high in calories and those types of sugars absorb very quickly into your bloodstream, so they'll affect your blood sugar levels quickly. And there's the picture. So this is the My Plate method. So non-starchy veggies and fruits, half of what you're eating every time you eat, a lean protein, and a portion of a starch or grain. So I like to tell people, even if you're having a snack, try to include some kind of a healthy protein and some kind of a fruit or a veggie every time you're eating. Okay.
So I think we're going to go just a little bit into, because you hear about this, talk about carbohydrates. So there are three main types of carbohydrate, and carbohydrate is basically another word for sugars. They're called complex sugars, which are the main source of energy for your body and affect your blood sugar and blood glucose and diabetes. So carbohydrates get digested relatively quickly and easily and turn into glucose. And carbs are the food that affect blood glucose the most. And there are a variety of carbs, including fruits, starchy vegetables, breads, pasta, rice, sugar, syrup, and some beans and stuff too. So sugars. So those are the fast digesting carbohydrates. And so there are two main types of sugar. The first is naturally occurring sugar that basically occurs in things like milk or fruit. It's there. And generally those are actually a little more slower digesting than the added sugars, so basically refined cane sugar that we add into many different foods, including canned fruits and heavy syrup, sugar added that you do in baked goods like cookies. So having sugar or very sweet things when you're diabetic will make your blood sugar go up very quickly. So starch is another word for basically the slower digesting carbohydrates. So you can have some starch in starchy vegetables like peas, corn, lima beans, potatoes, also things like dried beans, lentils, black-eyed peas, split peas, and then basically all your grains, so the wheat, oat, barley, and rice. So like the picture, all the breads, the pastas, rice, potatoes, those are all starches that have more complex carbohydrates. They won't spike your blood sugar like the sugar, in a cookie or, added sugar to a drink or soda, but they will cause it to go up significantly, especially if you're eating a lot, but it'll be a little slower. And then the last thing is that the other carbohydrate is basically fiber. So fiber is the indigestible part of plant foods, including fruits, vegetables, whole grains, nuts, and legumes. When you consume fiber, most of it passes through. It's the roughage that passes through your gut. And for good health, adults need to try to eat between 25 to 30 grams of fiber each day. Fiber contributes to digestive health keeps you regular, and it makes you feel full. So you'll be full because of the fiber, but those are not carbohydrates that cause your blood sugar to go up, and you don't really get calories from them. So you're getting full and satisfied, but you're not having your blood sugar go up. And another thing is fiber, diets high in fiber also help reduce cholesterol. So that's why for diabetics, we want you to have carbohydrate sources that are high in fiber. So the vegetables that are high in fiber, more of the whole grains that are high in fiber, because they will fill you up but not cause your blood sugar to spike so much.
Okay, so nutrition resources. If you have a diagnosis of diabetes, you're entitled to get counseling on nutrition through your insurance company. It should be provided by an RD as a registered dietitian. It is covered in full by all Medicare Part B plans. You do need a referral with that plan from your primary care physician. But they will provide you information on diabetes, what diabetes is, kind of a little bit about what we're talking about here. they'll talk about renal or kidney disease. I'm not sure why I put kidney transplant the past 36 months, but
I think there might be criteria to.
oh, these
to
are
get it covered,
criteria.
yeah.
Okay, gotcha. So those folks can get that covered too. But this is something that you could receive in every year, a rolling 12 months for an hour after your first 10 hours of education. So basically, through Sparrow, they do a very entailed diabetic class, and you can take them at a couple different places. I'm not sure if they do them here at this facility at Alive, but I know they have some satellite sites that might be closer to your home that they'll take the whole day, and it's pretty much an 8-hour day, and they'll have a dietitian, they'll have a nurse kind of go through many things, and then they also offer shorter 2-hour classes in East Lansing at the Sparrow Health Pavilion. So whatever works into your schedule, if that's something that you haven't done, or it's very helpful. You get a lot of in-depth information. So, oh, this is another graphic of that My Plate. So again, more diet recommendations to fruits and veggies, a protein, a grain, a dairy.
All right, and then the last part is obviously we want diabetic patients to be active and enjoy their activity. So you want to set a goal to be more active most days of the week. You know, you can start slow just by taking 10-minute walks a couple times a day. It is recommended that at least twice a week you want to do something to work on your muscle strength or resistance kind of exercise. You can do that at home with things like stretch bands, do some things like yoga, but also doing some outdoor activities, some gardening, other outdoor activities, yard work will all be kind of count toward those kind of strength activities, or doing more gym-like activities like push-ups, coming to Alive, using some of the machines like that. All of that is good, and particularly for diabetes, exercise is very important. When you are active, the cells of your body become more sensitive to insulin, so it works better. So you're using the insulin that your body's already producing. And when you're actually in the process of exercising, your cells will actually take glucose out of the blood by using a mechanism that doesn't really need insulin. So again, diabetics, if you're going for a walk or you're doing some other exercise, you're actually lowering your blood glucose at that time without any medication. And when you lower, and basically that will lower your A1C. And when you lower your A1C, you'll be able to take fewer diabetic pills or less insulin. And then there are many other health benefits for exercise. It lowers your blood pressure and your cholesterol. It lowers your risk for heart disease and stroke. It burns calories to help you lose or maintain a healthy body weight. It increases your energy for your daily activities. Patients who exercise sleep better. It helps relieve stress. It strengthens your heart and improves your blood circulation, strengthens your muscles and bones, keeps your joints flexible, helps older patients in particular improve their balance and prevent falls, and reduces symptoms of depression and overall leads to improved quality of life.
Okay, so just some other tips and tricks about staying active. If you are sedentary, sitting a lot during the day, it's recommended to interrupt that at least every hour to hour and a half with a good 5 minutes of activity, whatever that may be. Going outside, walking the dog, doing some yard work, taking the trash out, whatever fits into your daily routine. And then this is a little bit about goal setting. So knowing how important getting some physical activity is. To be successful, it's really important to really choose something to do and be very specific. I will walk, okay? And then how often, when, or how often or when you will do this. So being very specific with those goals can kind of help prepare your mind to achieving that goal. So you may say, I will walk, and it's going to be for 10 minutes, and it's going to be, maybe at 7 p.m. after dinner every day. Something, again, that you're thinking about your daily life and what will work for you. And then thinking about, is that goal realistic? Again, not trying to change too much at once. You want to set yourself up for success so that you feel good about what you've done. And if that doesn't happen, if you set a goal that's, just too much, you didn't achieve it, you can reassess that. You can look back and say, well, maybe that's not realistic. Maybe I don't have an hour 7 days a week, and so I'm going to back that off and reset my goal. But don't give up, okay?
And the last is there are many everyday tasks that you need to do to keep your diabetes under control. The first being taking the medications for diabetes and any other health problems, even when you're feeling good. Tell your doctor if you're having trouble affording your medications or if you have side effects that are preventing you from taking it. Most often, many of the diabetes medications are available in very low-cost generic medications. So work with us if you're having trouble with that, or if you're having side effects, we can change medications so you can be able to manage your diabetes without suffering the side effects. You do want to brush your teeth and floss to keep your mouth, teeth, and gums healthy. It's very much recommended that you stop smoking, ask for help to quit, and you do want to keep track of your blood sugar as recommended by your doctor. And then definitely learn about your medications. It's important to know about your medicines. Many diabetic medications do lower your blood sugar levels. Work with your care team to learn about when to take your medicines and how to store it. Learn about the side effects and how to manage them. Depending on your needs, you may need to take pills, an injectable medicine, or injectable insulin. The diabetes medications work in many different ways. They can make muscle and fat cells more sensitive to insulin. They can stop your liver from producing too much extra sugar. They can help your kidneys absorb less sugar and get rid of that sugar. They help the pancreas release more insulin, or they slow down digestion of food after the meal sugar levels don't get too high. So the medicines work in very different ways. So definitely, again, talking about your symptoms. One thing I do want to talk about with this slide is many people know about the symptoms of low blood sugar. And low blood sugar usually is caused by taking too much of the medication at a time when your blood sugar isn't as high as it has been. So usually patients who have diabetes who are not under treatment do not have symptoms of low blood sugar. I hear this a lot, patients kind of coming in, it's kind of a misconception. Usually the low blood sugar is caused by either taking too much insulin or taking too many of the other meds. And so if you're having low blood sugar, you need to talk to your doctor to adjust them. And those symptoms are feeling nervous, shaky, tired, or getting kind of sweating and kind of clammy. And then again, we talked about the high blood sugar symptoms, feeling very thirsty, needing to urinate a lot, feeling tired, or even getting blurry vision. Anything to add?
No, I think you covered it. Sometimes these symptoms can be very generalized, so you may not associate it with what your blood sugar levels are. But if you're feeling these things, then we may recommend adjusting medications. We may recommend you monitor your blood glucose levels and check your sugar levels a little bit more often to kind of see what's going on. Is it after meals that it's dropping a lot? Is it in the morning? Is it at night? And then that'll give us a better idea on how to direct you to care for yourself better.
Yeah. And one thing I tell, if you're feeling symptoms like this and you're able to check your blood sugar in the moment, so that, we know, is it high, is it low, is it normal, and maybe what you're feeling is not related to your diabetes. So do check, if you're feeling these symptoms and you have the capability, do check your blood sugar. And then one, I just wanted to touch on this for diabetes and feet. You hear a lot about this. It is very important to take proper care of your feet if you're diabetic. This is because any type of foot injury, no matter how small, needs to be basically, you need to tell your doctor or your healthcare team who can assess and treat the issue, because even a small sore on the foot can turn into an ulcer, creating a severe problem for diabetics, leading to infections. And that's when you see and hear about patients who had to have toes or their whole feet amputated because they've developed one of these and it hasn't been addressed or gotten infected. All right. Anything you
I
want
like
to
your
add?
little foot now.
Yeah.
It's cute.
And then the last thing is obviously working with your healthcare team to stay healthy. At each visit, you're going to want to get your blood pressure checked. You're going to want to have the doctor or provider will want to look at your feet. At least twice a year, they will want to do the blood test to check the A1C. If you have been not at goal, so above 7, they may do that more frequently, about every 3 months. And then at least once a year, they will want to do check your cholesterol, do a complete diabetic foot exam. You will want to get your keep up with your dentist. It is recommended that each year you get a diabetic eye exam to check for eye problems. We recommend the flu shot because if you do get sick, you have more potential for complications from the flu. And then they will do a urine and blood tests to check for kidney problems at least once a year.
So there's a few slides on here for self-management resources, and I did include a written copy of that at the back table, but there's this PATH program. It stands for Personal Action Toward Health, and they are local, and they will do these programs that kind of rotate throughout the year. So there's a website there. It basically, they go through day-to-day techniques to manage diabetes. They do weekly goal setting. It's Michigan's name for the standard chronic disease self-management program. So that can be very helpful. I can always, if you were to call any of the Sparrow Medical groups in Potterville or Lansing, we can always get you an up-to-date program if you're not able to have internet access. And then here are some more resources. The American Diabetes Association, they have self-management tools that you can print out for free. Learning About Diabetes has some more materials that give you information about diet, the disease process, medications, prevention, complications. It's available in English and Spanish on that website. And there are resources for children and teens on there too. So here are some more, diabetescare.net. This is a free resource. It has educational tools, including recipes, blogs. So some of that online support, you might connect with someone who could provide you with some support. Again, lots of recipes and resources in the community. There's an Ask the Expert blog if you have questions. There are videos on there.
And then we'll do some of the other sources.
Okay. So, those are some reputable sites. You can find a lot of information out there, and you want to make sure you're looking at sources that are going to give you correct information.
If they're recommending a specific drug, generally that's coming from that company, so kind of stick to a reputable source, and we have some of that printed out for you. So we covered a lot. Do we have any questions? All right, up front.
A couple weeks ago, when I got up in the morning, I felt like my sugar was low.
Mm-hmm.
I was shaky and all those other symptoms. And when I took my numbers, took my blood, it was 138.
Mm-hmm.
So that wasn't too low.
Mm-hmm.
But I got sick. After that, during the day, I couldn't eat anything. So what do you do when you're so sick you can't eat anything? I'm sick to my stomach, but yet you feel like you're crashing.
Oh. That's difficult, and a lot of diabetics do run into that. It depends on what type of medications you're on and your diabetes. So the first thing I wanted to bring up is sometimes when you start a new medication and we're bringing your blood sugar down, you can have symptoms of feeling low, but your blood sugar, like you said, is not low. It was 130, which is completely safe. But that's because people who've been running higher, who their A1C might be 10 or above, and their average blood sugar is about 200, their bodies are kind of used to being at 200. And so when you bring down closer to 100, people won't feel well at first. I'm not sure if that's what happened in your case, but if you are not feeling well, you're not able to eat, you generally should, not take any short-acting insulin if you're on short-acting insulin. And then for some of the oral meds, you're probably okay holding off on some of those and just kind of making sure you're hydrated. And if you have specific questions, you can probably call your doctor's office, or if there's an Ask a Nurse service through your clinic, and they might be able to look up your specific medications and give you some kind of specific
I
advice.
wasn't on any new medication. It was, I think I just got really sick to my stomach.
Yeah,
But I was concerned because I couldn't eat anything all day.
yeah,
And I felt like I was going too low.
yeah.
So you were getting ill, had maybe some GI stuff going on. We do have some recommendations for sick days, and some of those websites will provide you with information. You can always ask your doctor for some written materials on that. There are specific recommendations about how often you should check your blood sugar when you're not eating or drinking. The first thing would be to encourage the fluids. They may even recommend drinking some of those sugary drinks that we don't normally want you to take. Particularly something that might last a little bit longer, like a milk if you're able to tolerate it, if your tummy is able to tolerate it. But it goes into, checking up to every 2 hours if you're feeling really ill. And then depending on if you're having a lot of loose stools, if you're having any vomiting, making sure you're hydrated is going to be very important. So it sounds like you had a bug of some sort, and that can definitely affect how you're feeling.
You can hold off on, many of those things, and especially if you're checking, you can hold off. And if you were in 130, I think you'd be fine not taking your medication that day and just kind of monitor. But once you get back to eating, or if you're starting to drink a lot of soda or Gatorade to kind of rehydrate,
And you
then
don't
you
have
don't
any
want
of
it.
that stuff in the house.
No, you shouldn't, yeah.
It's like,
Yeah.
I don't have anything like
Yeah.
that to take.
Yeah.
And,
It's actually, that's a good point, because there are some of my sick days materials will recommend having a kind of like an emergency box, or if you're, just like if there's a snowstorm, if you're not able to get to the grocery store, or if you're sick and you need some extra things that you wouldn't normally eat or drink or keep on hand. So that's a good point.
There was another question.
I've been a diabetic for about 7 years, I think now, and I keep very good control over it. My A1C is usually 5.7. But when I had my Medicare well checked this last spring, the nurse practitioner said that there's some kind of different research out now as to whether or not we actually really need to test our glucose daily when we do keep it in such good control. And I'm just wondering what your thoughts are on that.
I think that, obviously you should talk to your specific doctor,
Right.
but if somebody's on just like an oral medication or controlling their diabetes simply with diet, and the A1C has been very well controlled, you really don't need to test daily.
You would
Yeah.
agree with that?
Yeah, I would agree with
Even
that.
though I do take metformin.
Yes, and yeah, if you just take metformin and you've been really well controlled, that's fine. Yeah. In the back.
My doctor told me that she went to a conference, and that AIC, she said, I've been too hard on you, because people 80 or over, their AIC is higher.
So basically, yes, the new recommendation is that for patients who are above 80, maybe we can give you a little leeway. Your A1C is not necessarily naturally higher, but what we don't want is, we're very concerned that your body is more sensitive to medication, and we don't want you getting low falling, having an injury, usually it's said that we could give you a little leeway, and they can say as long as you're below 8, you're
That's what
gonna
she
be
told me,
okay.
yeah.
Yeah, and some patients will be fine just on one medication, and they'll be your age, and their A1C will be 6.5, and we don't necessarily want them to go and have a donut every day to bring that up. But we just don't want, particularly patients who are on insulin, to be really shooting to stay really low when they're 80 years old and then suffering consequences of low blood sugar. Yes?
We're pretty good on how to figure out the carbs, but is there a guideline of how much protein to have with the carbs for a diabetic?
It varies kind of by your activity. So protein in and of itself will not cause your blood sugar to rise. So if you eat an egg, you eat a piece of meat, that really doesn't cause your blood sugar to go up. You just don't want to be eating, too much protein, particularly that has fat in it. So, ground beef, eggs have a little bit more fat. You don't want to be eating too much protein and then getting your cholesterol up. But I think an average serving of protein is technically, like an average serving of meat is technically 6 ounces, which is about the size of a deck of cards, which feels very small for the average American. But there's not that I'm aware of like a specific.
You can, I would have to look up, it's based on your age, whether you're male or female, what your recommendations are for grams per day if you're a label reader. The information can be found online, but I don't know specifically what your goal would be.
Yeah. All right.
When I saw the graphic on the foot,
Oh.
I'm not a diabetic, I'm a pre-diabetic, but I've had that foot tingling pain for probably about 5 years.
Mhm.
And I never really, it's been uncomfortable, but I haven't had anything. But when I saw that, I was wondering if I should be checking with my doctor about that.
Yeah.
Because it sounded like there was some complications for that.
Yeah, so you probably should, you said you're pre-diabetic?
Yeah.
They probably should at least, be checking your feet when you go in and maybe do a full foot exam once a year for your feet to just check the extent of it. And then every day, you can just look at your feet, make sure you're not, what happens is if you're having that tingling, you may not feel if you get an injury. And then, so you have a cut, you have a blister or something that then you won't notice and it can develop and get infected and lead to problems. So I think you can check your feet every day, just make sure you haven't suffered any injuries, and then, you can talk to your doctor about doing a yearly foot exam, full foot exam.
Okay.
Yes?
If you're not diabetic, excuse me, but you have a family history of that, how often should you be checked for? Like once a year or something?
Yeah, I think once a year with your standard blood work. Obviously the biggest thing is controlling your weight, eating a healthy diet, and, controlling your other health risk factors like blood pressure and cholesterol all play a role. But I think once a year, just doing kind of standard blood work with your doctor would be more than sufficient.
Is there a specific doctor that does blood diabetic people? You have a podiatrist or you have a nephrologist. Is there an us out there for?
So there are some diabetic specialists. They're usually in the group we call the endocrinologists, who are the hormone doctors. Usually type 1 diabetics will follow with an endocrinologist. Some, if they're very well controlled, know how to manage, may not see them that frequently. For many type 2 patients, unless you're on a high dose of insulin or we're having a lot of trouble managing your blood sugar, then most do not go to see an endocrinologist frequently, unless we're kind of really out of control. All right.
Last one, sorry.
No, that's all right.
2 questions, actually. On one of the slides that you had, I missed it, and I missed the site. It was DLife.com.
Oh, yeah, that was down there. I
Okay.
saw, yeah, that was one
Oh,
of the
yeah,
ones
okay.
that,
What
yeah.
was that one?
That stands for diabeticlife.com,
Okay.
and it has a lot of resources there. They have recipes,
Okay.
and it looks like community resources, and it maybe connects you with some more local resources, and then there are some forums and blogs on there, and some videos too.
And then my second question is, sometimes like what you were talking about with the high blood sugar and you're constantly hungry, I suffer from that. And like I'm constantly, I feel the need to want to eat all the time, but I maintain a pretty decent blood sugar, like my A1C is 7.2, so, but I'm constantly like, so what could be some tricks to kind of, should I be telling myself don't eat and stick to my 3 meals, 3 snacks, or do you eat when you feel like that?
I think the biggest thing is kind of we actually don't want you to feel hungry and be miserable all day. That's not going to be easy for you to, manage. What I would say is look at what you're eating. So having some things that have some more protein in them, some more of that fiber will keep you full longer. Usually that feeling hungry, feeling thirsty, and having to go to the bathroom all the time is really when your sugars are high.
Okay.
People feel that, or when before they've been diagnosed. So those are kind of warning symptoms for the general public.
Okay.
But what I would say is look at kind of what you're eating and kind of, make sure that it's not something that's just, simple sugars, because what will happen there is your blood sugar will go up and then you'll kind of crash and then you'll want to eat something, which is normal. And that'll happen to anybody who kind of,
I just was wondering, because that's something I do. I'm like, I'm still hungry.
Yeah.
Like right now, we just ate lunch, and I'm like, I wonder where snack's gonna be.
yeah.
So I just wondered if there was something, I don't think my sugars are high, so,
Yeah.
But I just wondered, why some people feel that way.
Yeah, I think I would try and get some things with more fiber, some more protein, some more, of the complex carbohydrates that'll keep you full for longer, but not spike
So
too much.
maybe not so much fruit, because I eat a lot of fruit for snacks. And maybe I should get in then maybe with, like you said, proteins and like nuts and
Yeah,
something
so-
that's a little,
Or you could do fruit with some Greek yogurt, fruit,
Okay.
and it also depends on what kind of fruit,
The
so.
only thing is with that, sometimes like it's too high. Like my snacks can't be over 15 or 30, so you already put a piece of fruit in, I'm at 15, I'm really not supposed to go too much higher than that,
Yeah.
and you're like, so the fruit, or just say a cheese and a yogurt, sometimes it's over your amount.
Mhm.
That's what I worry about too.
Yeah.
So.
I think that it might be helpful if you were, I don't know how much time you have, but if you were able to kind of log what's going on, when I eat this, I'm feeling hungry in about an hour. A lot of the simple carbohydrates that Dr. Baxter talked about, so so some of your fruits that don't have as much fiber in them, or cookies,
Yeah.
sodas, those types of things, even pasta, rice, breads, those will keep you full for maybe an hour. As opposed to if you're eating things that are higher in fiber and protein, if you're having that included in each snack or meal, then that'll keep you full for more than, or for an average of about 3 hours.
Okay.
And kind of keep you going longer.
Yeah.
Because those don't break down as quickly and they can stay in your system longer. And that's easier on your blood sugar levels because you're not going up and down all day. You're kind of maintaining a little bit longer and keeps you fuller longer. Any other questions? Well, thank you for joining us today.
Thank you. Thank you. Yeah.